I'm here recuperating after both my knees got done for a bilateral knee replacement. The right was done on a conventional mode. The left went Mako Robotic Surgery. The cause of the entire episode was I had a fall 2.5 years ago. Not a fall, I missed a step, went thud on the concrete, and it didn't react quick enough. But a week down the track, when I went and saw my GP and a specialist, they said it was only a meniscus tear, which over a period of time got to a stage where I had to have both my knees replaced. The corrective version at that point in time could have been a arthroscopic surgery version, whereby they could have cut up the meniscus and lined it up, but that didn't happen for whatever reasons. Yeah, I was here last year when things were not looking very good, and this was through Dr. Sanjeev Singh and Dr. Mohit Sharma. They had an appointment set up for me, Dr. Tilak, and we had a spell of about an hour before we decided that over procedures conducted that the knee replacement was the only solution. Dr. Tilak and his team have I would say it's not short of a miracle. It's been only 4 days and I've been able to walk without braces, and the frame, for which I got told off. They said, no, I've got to have the frame on no matter what for the next 4 weeks. You're healing up too fast, too quick. So I told them, no, it was not my healing up too fast, too quick. It's their job that got done, which got so good that I don't feel the pain anymore. Even at times at night I don't even go looking for the frame. I just toss out of the bed and go straight to the toilet, not knowing that the operation got done only about 2 or 3 days ago. So to cut it short, Dr. Tilak has been a godsend. The team did one of those jobs that probably I couldn't envisage anyone else anywhere could have worked on it as good. They say no pain, no gain, but I've got no pain. I've gained everything in the process.
The 61-year-old male patient came to us with bilateral knee pain. He is working in Australia and a very active person, but all his activity were cut short because of his knee pain, which never got relieved with the medicines and physiotherapy exercise. So he has reached a stage where the pain was affecting his day-to-day activities, and he came to us for an alternative. And we took x-rays, weight-bearing films, and we found that he had bilateral medial compartmental arthritis, of which the right side was a bit worse than the left side. Since he was 61 years and he wanted some effective treatment, we suggested him robotic arm assisted joint replacement surgery. So we did a total knee replacement on his right knee and a bicompartmental knee replacement, especially involving his medial compartment and patellofemoral joint. Immediately after surgery, on the same day itself, we mobilized the patient. We helped them to walk with support and do a lot of exercise, and he was extremely comfortable. He had very little pain compared to the regular surgery, and we could do the rehabilitation in this patient very fast, and the patient was very comfortable and very happy with the surgery and could do his rehab exercise quite effectively. In about 2 days' time, we could discharge him, and he has gone back to his country where he is working in Australia. The advantages of this machine is that the precision of the bone preparation or the bone cuts we make to implant an artificial joint is extremely accurate. The whole machine helps us to do the operation in a very precise manner so that the amount of soft tissue damage around the joint is very little. So ineffectively, the patient has very less pain compared to a manual surgery, regular surgery. with the robotic arm assisted, the patient could rehabilitate faster. The same day they are made to walk, the amount of exercise they can do post-operatively is very effective. Maybe because the amount of pain they have after the surgery is much less compared to a regular surgery. So those are the advantages which we could see with this particular new technology what we have.